Hello everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. In my work with my clients, I help them use both food and lifestyle as tools to improve their health and wellness and to help them feel better. Today we are talking about SIBO, or small intestinal bacterial overgrowth. SIBO has become a lot more common in the general population and with those who have autoimmune diseases. It's a huge pain to live with and to treat. So today I'll cover what SIBO is, what causes it, why so many people with autoimmune diseases have it, and then how to try to get rid of it. Before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. Please consult your qualified health professional for any changes you make to your medical care. All right, let's first talk about what SIBO is. So the lower half of your gastrointestinal tract, remember that's an open tube that runs from your mouth to your anus. It's divided between the small and the large intestine. The large intestine is where almost all of our microbiome lives. It's rich in bacteria and actually needs a healthy balance of bacteria to function. On the other hand, the small intestine, which is actually much longer than the large intestine, it does not have or need bacteria present to thrive. In fact, it has very little bacteria living in it. And this is because food moves very rapidly through the small intestine, and because bile also mixes with food and it neutralizes the bacteria that comes from food and the outside environment. So SIBO happens when bacteria from either the mouth or the large intestine travel up or down to the small intestine and proliferate. This overgrowth of bacteria causes a whole host of problems for the digestive process. It can include symptoms like diarrhea, constipation, bloating, nausea, abdominal pain, to name a few. So a hydrogen and methane breath test is the best way to diagnose SIBO. Bacteria produce either of these gases. So when levels are higher than normal, it indicates that those bacteria are present in the small intestine and that you do have an overgrowth. So there are a number of different factors and reasons and causes of SIBO, some of which include having low stomach acid. So this can prevent gastric acid from destroying bacteria found in the food and environment. Medications like antibiotics or gastric acid suppressants. So antibiotics, as we all know, wipe out the gut microbiome, and it can cause issues with bacterial balance when it repopulates. Gastric acid suppressants have the same effect as low stomach acid. They lower your stomach acid so you're not able to really fight off the bacteria that you're getting through food. Other causes, motility issues like gastroparesis or hypothyroidism, which many people who have a slow thyroid also have gastroparesis or slow moving digestion. So when digestion moves too slow, that undigested food sits in the small intestine for too long and it can actually ferment and grow bacteria, which is not what we want. Another reason for SIBO is intestinal obstructions. Again, that can slow down motility, causing the same issues that I just mentioned. And then lastly, stress, smoking, and poor diet. So all three can disrupt the microbiome balance and increase inflammation in the intestinal lining, which can ultimately lead to SIBO. So why is SIBO so common in autoimmune diseases? Well, there's a number of reasons why this happens. One of the most obvious reasons is because the immune system is not robust enough to clear bacteria from the intestinal tract. Also, many people with autoimmune diseases have intestinal permeability or leaky gut. This causes bacteria to flow in and out of the intestinal tract, and it also increases inflammation in the gut lining, which alters the gut microbiome and may also cause overgrowth of harmful bacteria in both the small and the large intestine. Lastly, SIBO may actually be a root cause for the development of autoimmune diseases. So how do you treat SIBO? Well, SIBO is one of the most frustrating conditions to treat. One reason is because it's not very straightforward, and in many cases, SIBO is not eradicated in just one round of treatment, and you have to try multiple treatments to see what works. So there's a few options when it does come to SIBO treatment. The first option, which most doctors will steer you towards, are using antibiotics. So antibiotics are used to wipe out bacteria so you can regrow a healthy microbiome. And rifaximin is actually the one that's commonly used because it actually targets the bacteria in your small intestine. This usually takes about 10 to 14 days of an antibiotic to see signs of improvement and to hopefully, eradicate the bacteria that's in the small intestine. Another option is going the herbal route. So there are actually a handful of herbal supplement combinations that have been studied and shown to be just as effective as antibiotics, which I think is really interesting. Most of these herbal kind of remedies contain compounds like berberine, allicin, which is from garlic, oil of oregano, and neem, all of which are very potent antimicrobials. So people usually take a combination of herbal supplements for about 8 weeks of treatment. And then hopefully, that eradicates SIBO, and then you can kind of, go on and live the rest of your life. I should also mention too that herbals are a great alternative to using something like rifaximin, because a lot of times people don't get that covered with insurance. It can be really expensive. So having kind of the herbal remedies out there as something that's just as good as antibiotics is really, really helpful. So there's diet also, which honestly is not my first approach to SIBO. I tend to go towards the herbals first. I'm not allowed to prescribe medication. So if I have a client who tests positive for SIBO, I'll start them on a herbal treatment. But if typically when diet or if the herbals don't work, then I do herbal treatment with a low FODMAP diet. And there's decent research backing its effectiveness for helping keep SIBO from rebounding. It is a very challenging diet. A lot of people don't do it correctly. So it's really important to seek help from a qualified professional who's familiar with FODMAPs and familiar with the elimination diet structure of it, so that you're able to reintroduce foods quickly and figure out what your tolerance is to different foods that contain, different FODMAPs. Lastly, there is the elemental diet. And this is a worst case scenario, everything else fails, SIBO is not responding to treatment, then you might need to start investigating and try an elemental diet. So this involves drinking a special diet formula that has pre-digested carbs, proteins, and fats. The formulaic diet allows your gut to rest, it prevents food from contributing to the bad bacteria, and it also helps you absorb nutrients more efficiently. Most people stay on this for about 2 weeks. So as you can imagine, a full liquid diet for 2 weeks is insanely challenging. A lot of people can't do it, which is why a lot of people don't do it. But I do know people who have done the elemental diet and it has actually reversed their SIBO, and they've been able to maintain their SIBO-free status for years after that. So the other note about an elemental diet, absolutely should this never be done alone. You need to do an elemental diet under the care of a physician so they can monitor your vitamins, minerals, and electrolytes. Super, super important. Never, 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 ever do an elemental diet on your own. Okay, so that is what I have for SIBO today. I could talk about this for hours. It is such a complicated condition, so many things to talk about. So this is just like the tip of the iceberg, general what you need to know about SIBO. But if you do have any questions, please drop them in the comments. I do try to respond to those fairly quickly if I can. And if you are interested in learning more about how I work with people, or you would need help managing your autoimmune disease or your digestive issues, I love chatting with people. I love helping them feel better. So if you go to my YouTube profile, there should be a link to book a free discovery call. If you can't find it there, it is definitely on my website. And there is a link to my website, AnnieRubin.com. My website has lots of information there too. There's a blog, it lists all my services and so forth. So check that out. If you do not subscribe to my YouTube channel and you just found me, welcome. I love having new people here. Please hit the little subscribe button so you can stay updated on when my videos are posted. I do try to put them out about every week. Just trying to give you lots of information related to autoimmune disease and how you can better manage your symptoms with diet and lifestyle. So thank you so much for joining me, and I will see you next time.